We're seeing some improvement in our positivity rates. Our daily positivity rates have leveled off and actually are decreasing. And we're beginning to see some other downward trends, such as the decrease in the number of days it takes to double our cases. In early July, it was taking approximately 26 days to double. Now we've extended that to 30 days. And the best explanation for these changes and the positive progress we're making is the wearing of masks. We believe that wearing the mask, facial coverings, have had a great impact on our rate of transmission. We asked the University of Memphis School of Public Health to conduct a study looking at the use of masks. And we have today as a guest one of the students who participated in this study, Gabby Dowdy. She's a student at the Public Health University of Memphis School of Public Health. She will come and she will present the results of this study at this time. Will you, Gabby, come to the podium?
Thank you, Dr. Randolph. Thank you, Mayor. Good afternoon. My name is Gabby Dowdy. My colleagues Geraldine Carmichael, Eric Calabaway, and Becky Cronenberg and I are honored to be here to present our data to you. We're thankful to Dr. Haushalter and to the University of Memphis School of Public Health for this opportunity. We have been measuring mask use compliance in Shelby County. The purpose of our study was to measure the mask adherence with the Joint Task Force recommendation for mask usage to reduce the COVID-19 transmission. We hope this data would inform communications and policy strategies to help improve compliance. Next slide, please. We counted the number of individuals who were correctly wearing masks. We did this via two methods. One was via direct observation in 20 large retail settings. We went to 10 stores in high transmission zip codes and 10 stores in low transmission zip codes. High transmission areas are the zip codes with a higher rate of cases per capita. We also reviewed videotapes of city cameras at popular outdoor areas such as Highland Avenue, Madison Avenue, and Beale Street. Next slide, please. So we collected data pre-policy and post-policy, which was the mask ordinance and the health directive. So pre-policies, the overall mask usage was 51%, and we observed over 4,000 participants. Mask usage by age was 35% for those 2 to 18-year-olds and 64% for those 55 years and older. Correct mask usage was a bit lower, with the correct mask being over your nose and mouth. 2 to 18-year-olds, only 31% wore their mask correctly, and 61% of those 41 years and older wore their mask correctly. The lowest mask usage was seen in the Hispanic community with only 34%, and the Asian community had the highest mask usage with 91%. Post-policies, the results were significantly higher. We observed nearly 4,000 people, and the overall mask usage was 92%. The mask usage by age increased, with 85% of those 2 to 18 wearing a mask, and 94% of those 41 years and older wearing a mask. Correct mask usage was also increased, with 78% of those 2 to 18 wearing their mask correctly, and 92% of those 41 years and older wearing their mask correctly. There was an 88 to 92% of mask usage among all ethnic and gender groups. There was only a 1 to 2 higher rate of transmission of compliance in the low transmission zip code. Next slide, please. So the video surveillance was also done pre and post policies. Pre-policy, we observed 23 hours of videos, and the correct mask usage never exceeded 60%. In 21 of those 23 videos, only 2/3 of people did not display proper mask usage. Post policies, we observed 21 hours of videos. The highest rate of mask usage was 67%. In 17 of 21 hours, at least 60% of people did not display proper mask usage. Overall, in outdoor public spaces, data indicates a slightly better compliance with the city mask ordinance and the county health director. However, the results were still far from optimal. Next slide, please. So we do have a few recommendations. First, we need to ensure correct mask usage so that everyone knows that the mask should go over their mouth and their nose. So to do this, we suggest perhaps commercials or internet ads that explain how to properly wear your mask. We should also focus on those groups with the lower compliance, which was the 2 to 18-year-olds. So perhaps YouTube videos to target children, and maybe TikTok videos or Instagram to target teenagers and young adults. We should also do observations at smaller retail stores. We only went to large retail stores for this study, but we should look at gas stations and corner stores as well. We should also enforce correct mask usage, even when people are just going in to pick up to-go food, just running in and out quickly, or even just going in to get gas and coming out quickly. They should still be required to wear a mask. Next slide, please. Lastly, we would like to acknowledge those who really helped us along the way. Dr. Levy and Dr. Nolan from the School of Public Health, Dr. Haushalter from the Shelby County Health Department, Dr. Jane, Dr. Warren, Deputy Chief Don Crow, and all those who participated in the mask usage survey. We really thank you guys for your help.